Hi, my name is Watinita Sari, and today I'm going to present some information from a study article called Global Epidemiology of Early Onset Liver Cancer, attributable to specific etiologies and risk factors from 2010 to 2019. So for method and general design, this study is a cohort study or non-experimental observational study. It is the Global Burden of Diseases Study 2019 of that 2019 data to determine age standardized disability adjusted life years. Also known as DALY, DALY, rate for the early onset liver cancer is calculate estimate annual percentage changes, EAPCS, to measure temporal trends. This study is conducted from 2010 to 2019. The database covers about 204 countries and territories divided into 5 categories according to the Social Demographic Index, SDI. So the 5 socio-demographic index are age group, gender, region, country, and etiology or causes. So for age group, liver cancer burden estimation is stratified by different age groups, indicating variations of early onset liver cancer across different stages of life. Gender is based analysis separately for males and females, recognizing potential gender-based disparity in incidence and outcomes. For region, it assessed across different regions globally, likely considering variation in healthcare access, environmental factors, and prevalence of risk factors such as hepatitis B and hepatitis C viruses. And for country, the study covers 204 countries and territories, indicating a global perspective on early onset liver cancer burden and reflecting differences of healthcare system, social economic conditions, and prevalence of risk factors. And etiologies, causes. So liver cancer causes are categorized based on different etiological factors, including HBV, HCV, alcohol use, NASH, non-alcoholic steatohepatitis, steatohepatitis, and other causes. This categorization helps in understanding distributions of liver cancer burden based on its underlying causes and may guide targeted interventions and prevention strategy. So for risk factors to early life cancer, there are 5 of them, and it's listed here is smoking, alcohol use, drug use, obesity, and diabetes. So the study collected the numbers and populations attributable factors, or called PAFS, of the early onset liver cancer disability adjusted life years, DALYs, attributable of these factors between 2010 and 2010 and 2019, which is about 2.9 million DALYs related to early onset liver cancer globally in 2019. Additionally, the study assessed a cluster of this risk, include behavior and metabolic risk. It's calculate PAFs by age, sex, locations, and year for each risk factors, considering the relative risk as a functions of exposure level. The distributions of exposure and counterfactuals level of the theoretical minimum risk exposure level for each factors. So on this panel here, which include in the article, so I snapshotted here. So basically, the first column here, the leading risk factors from 2010, and the first one is the alcohol use, and it's about 374.4 of the DALYs, the number of DALYs. And the second one is smoking, and it's about 332.0. And the next one, high body mass index, which is being overweight, is 286.1. For drug use, 5 high fasting plasma and glucose. So yeah, and for the one to the right of it is from 2019. So the alcohol use is still the first one for the risk factors, but the body mass index is the second one for this one, and smoking is the third one instead. So it's switched off a little bit. And for number 4, drug use, and number 5, high fasting plasma. And then next to it, there's the number. So the number from 2019 is a little bit more than 2010. And there is the decrease in these pictures. And then the panel B here, just showing, different country or region from the global estimate. And I'm going to go ahead and move on to the next page. So for relative risk, so the relative risk, or RR, it is statistical analyst to estimate the risk associated with each concomitant factors on the early onset liver cancer. The RR is calculated as the ratio of the probability of developing liver cancer among individuals exposed to a particular risk factors compared to probability among unexposed individuals. And additionally, populations attributable risk percentage P PAR percentage PAR estimate are discussed, which represent the proportions of disease incident in the population that can be attributed to a specific risk factor. The study acknowledges the sum of PAR percentage attributable to concomitant risk factors might exceed 100% due to the mediation's effect of one or more risk factors on others. The study defined early onset liver cancer as occurring in adolescent and adult under 50 years of age. So for the result and finding, so in 2019, globally, there were about 2.9 million disability adjusted life years, or called DALYs, due to the early onset liver cancer, with an age standardized DALYs rate of 71.10 per 100,000 people. So the highest rate were observed in the East Asia, Southern Saharan Africa, particularly in Mongolia, followed by Gambia and Guinea. Over the period of 2010 to 2019, although the number of dahlias increased, the age standardized rate increased slightly, with an estimated annual increase of 0.39%. However, some regions like Caribbean, Central Latin American, and Eastern Asia show significant increases in age standardized DALYs rate, with Tajikistan having the highest increase at 11.98% annually. So this study found that in more developed countries, there's a lower increase in early onset liver cancer cases. This suggests that better education, health care, and income can help prevent or treat liver cancer earlier in life. So improving this aspect in society could reduce the burden of liver cancer. So for the health and prevention, there's guidance from Centers of Diseases Control and Preventions, or called CDC. And I also could find there are program available at UC San Diego Health More Center, that can giving some insight of keeping the healthy weight, suggested the vaccination for hepatitis B, and also to get tested for hepatitis C. And yeah, you can smoke less and drink less, so that would also help prevent to have a better health as well. So that's it for my presentation, and this is my sources, and thank you so much.